On into our live panel. And so we have our three wonderful speakers here. I'm going to have everyone, you can go into the Q&A option here and ask us questions to be sent directly to us as panelists, and we'll try to comb through them as we can. But our first question to our panelists here is, what advice do you all have around for friends who are fearing judgment or just social judgment around asking for help? What advice do you have for them? And we'll start with Amojti. I'll just start with Amojti.
Dang it, I was hoping I'd be not the first one to go. I think, when it comes to wanting to ask for help or just being afraid to take that step, I think often when we have folks ask us how we're doing, we only respond with like, "Oh, I've been great. How are you?" But when you have a friend that's asking you how you're doing, and it's not the conversational, letting people in is hard, but just going the baby step to be like, honestly, it's been a rough week, and just allowing people to care for you. I don't know if it's an American thing or if it's just a college student thing, but so often we feel like we have to do things completely by ourselves. If anyone gets a whiff of us not being these perfect Instagram perfect people, that we are flawed. But that's just so far from the truth. And the more we give in to this stereotype, the more we are getting away from being authentic to who we are and fighting that mental health stigma. So I challenge you, one, to not only be asking, the folks around you how they are actually doing, but when you yourself are asked to be vulnerable and to start answering those questions authentically and to allow people to care for you when you need it most.
Absolutely, absolutely. I'll pass this one off the same question to Hannah. I'll go through all three of you to kind of get through your different answers. So Hannah?
Well, that was a great answer. But on the contrary, I was going to say if you wanted to go out and seek help, professional help, whether that be or a trusted friend or an adult, you don't have to make it public knowledge and you don't have to tell people. That is your personal right to keep that to yourself. So I think that's also another important factor to kind of take into account, that your feelings and stuff can be private, but of course you are welcome and open to share. But that's something I think people always forget, that you don't have to let everyone know everything. So that would be kind of my takeaway from that question.
Yeah, thank you for that. And absolutely. Brandon?
Yeah, this is something I struggle with a lot. I sort of internalize things. I don't know. It's a really big challenge, and I think I'll sort of speak on like the other side of the issue. I think that as much as it like we all have um, not a responsibility, but you know, when you need help, it is important to ask if you're in a space to do so. But I also think on the other end of that is, what are we doing to create space for others to come to us? How are we making ourselves accessible? I think that that's really important. And I think that that is one of the trickiest things about the stigma around mental health, is that we sort of view it as like this taboo thing that like we don't talk about, we don't like hearing about it, we think that it's uncomfortable, and maybe sometimes it is, but I think that there is beauty in the uncomfortability of it. And I think that it's a really important thing, especially for your friends. And sort of going off of what Hannah said, I think that it's also important to recognize the amount of, or sort of like the different capacities of the resources that are available to you. So for example, if I were in need of like anxiety medication, I was having really bad anxiety problems, I would want to go to a psychiatrist for that. But on the other end of that, if it was just a thing where like I'm really anxious and I need someone to be there for me, I think that that's a situation in which reaching out to a friend would be appropriate. So I think know your resources, and then also be really intentional about creating space to be there for others, and also creating space for you to be able to receive help when it's presented to you.
Thank you all for those answers and for just sharing your own advice based on your experiences. So we have several different questions from people that are listening in right now, and I want to be able to get to as many of those as possible within our short panel time. So I'm going to ask each of you a separate question that someone in our audience is interested in. So Brandon, I'm going to start off with you. We have a question from the audience that asks, how do you feel Miami supports students struggling with mental illness? And how would you improve upon it?
What a tricky question. I think that the student counseling service does a good job of providing resources to students who are seeking them out. I will say from experience, sometimes it has been difficult, not even just like the process itself, but I think that there is a barrier to even asking for that level of help. Like for myself, I this entire year have, and the last year as well, I've wanted to go to the student counseling services, but I'm like, wow, I really don't want to call. I don't want to have to set up an appointment. I don't want to go. It's just a lot of effort. And so I think that one way in which they could improve upon that, and they have actually through partnering with ASG, is through the satellite counseling. So those are little like 15, 20-minute conversations that happen around campus where you can just go in and talk to somebody quickly. And I think that that is a good way to make it more accessible because it's a way for you to get your foot in the door, having conversations about your own mental health, because it is a difficult thing to talk about. So I think that we're doing a good job, but I think that we can always be pushing to make things more accessible.
Absolutely. Thank you for that, Brandon. So our next question from the audience would be, is what is the biggest opportunity on Miami's campus for moving the needle on reducing stigma and increasing well-being for students, community, or Miami staff? And so that question is going to go to Hannah. So I'll give you a second to
I'm like thinking.
Yeah, absolutely. I'll ask it again, just kind of let your gears going. What is the biggest opportunity on Miami's campus for moving the needle on reducing stigma and increasing well-being from students, community, or Miami staff?
Okay. I don't think there would be one definitive biggest opportunity. I think it's groups of people that are working together. So, say, for example, this night has ASG members, members of sororities, members of different majors, ages, races, everything. Like, it's just people coming together. And I think, like, talking about mental health in classes, clubs, Greek life activities is something that really would push ending the stigma sort around mental health. So I think it's just doing little things like that and it's beneficial. So that I don't know if that makes sense or if that's the answer you're looking for, but I just think doing everything you can and being involved and talking about it with your friends, family, classes, professors, everything can help.
Yeah, absolutely. Um, I think that having those networks is super important for being able to reduce that stigma and increase well-being here on campus. So, Amataj, I am going to ask you our next question. And each of you was able to share your own experience, and each of those experiences was unique. And so, keeping that in mind, how do you know when is the right time to ask for help or the right time to go to the student counseling services?
For sure. And I think for this question, I'll go a little personal. Um, for me, I never went to therapy or anything like that until freshman year of college. And that was because I had experienced SIV, which is an acronym for sexual and interpersonal violence, on Miami's campus. And I just remember, thankfully, none of my friends had experienced that before. So this wasn't something where you could Google search, like, how to feel better after insert incident. SIV is so nuanced that, my friends who had never experienced it, though they were empathetic and sympathetic, um, they just don't get it. And that, that's similar with marginalized communities, like, who experience racism on campus. As much as your white friends want to empathize and sympathize with you, they don't get it because they haven't experienced it. And I think that was the moment I knew that if I wanted to get better, if I wanted to heal, that I had to go see someone because this was something I had never experienced before. No one around me really knew what to say. There's a lot of stigma against SIV, a lot of shame, a lot of issues of vulnerability, and I just knew that I needed one-on-one kind of coaching through that process. And through student counseling services, I've had phenomenal experiences. My counselor, and then I'm also part of group therapy. Like that was mentioned in the beginning, I'm part of Circle of Hope, where people who have had similar experiences as me are able to talk freely and really just relate and heal and grow together. Um, However, with that being said, therapy and getting help is work. it is hard, especially reliving your traumas. But I think at a certain point, if you know that you need to heal and you need to do what's best for you, student counseling services is definitely the first step.
Thank you for that, Amataj. And I completely understand that. Like I myself have gone through group therapy sessions and therapy sessions through the Miami University Student Counseling Center and also our psychology clinic. And so I completely understand that, and utilizing our resources here on campus. And so my next question is going to Brandon. And so as we've all talked about here, we all have experienced mental health struggles. So how can I help a friend if I also need help? How can I help a friend if I also think I need help as well?
Yeah, that's I have a lot of friends who struggle with mental illness, so this is a common problem for me. I think that the most important thing is that, like, at the end of the day, you do have to prioritize yourself. And so if you need to take space to heal or to process, you're totally valid in doing so, and you should prioritize that. And I would say look for opportunities in which, even if it's not, talking directly about your mental health situation, finding opportunities to be with your friends and sort of get your mind off of things. But yeah, I would say the most important thing is prioritizing yourself, putting yourself in a situation in which you can help your friends, and then doing that. What you should try to avoid as much as possible is taking on the situations of others before you've coped with your own. I think that can just lead to a lot of really destructive things for your individual self. And so, yeah, just to reiterate, sort of just prioritize yourself.
Yeah, absolutely, Brandon. It's really important to be able to have those strong networks of friends, but also to have those healthy networks for both yourself and others. So this last question before we conclude, I'm going to ask to everyone here, starting with Hannah. And so this question is going to be, what are the tips that you have for giving space to friends to talk about their own lived experiences?
Do you mean, okay, I have a question following the question. Space as in allowing them to talk about their experiences, or space as in letting them kind of figure that out on their own?
Giving them a space so that you can act as.
Okay, yeah. So that's what I thought, just clarifying. I think it's really important when listening to your friends' issues to not be judgmental. It's so easy for us to kind of judge and say, well, if I was in your situation, I wouldn't do that. So what I really try to do is take myself out and put myself in their shoes. Another thing that I always do with my friends, if we are venting or just talking or talking about past issues, we always say, do you want to vent or do you want advice? Because sometimes you just need someone to listen and someone to hear you out. But then other times you want advice. So I think it's really important to establish that relationship with your friends and kind of ask them what they're looking for in the conversation. But I think my main thing is just being open and willing and non-judgmental, and just letting people know that you're there for them, I think is super vital. And this kind of doesn't correlate with the question so much, but sometimes if I feel like I want to vent or get something out, but I don't feel like telling a friend or don't feel like telling a relative, I write it all down, pages and pages of notebooks, and that kind of helps me get it out in some way, like, and so I'm not talking to someone about it. So I think that's also important too to recognize, but definitely just being there, non-judgmental, venting, or advice is good to clarify, in my opinion.
Thank you, Hannah. Brandon, I'm going to turn it over to you next to answer the same question.
Can you repeat the question? I'm sorry, I missed part of it.
Absolutely. What are tips that you have for giving space to your friends to talk about their mental health experiences?
Mhm. Yeah, I think Hannah answered it really well. I think the biggest thing is the biggest thing for you to remember is you're not always going to understand what someone's going through, and that's totally fine. And if a friend comes, well, the first thing is establishing that you are a person that is accessible, that can be reached whenever you need them. And I think that you can do that intentionally and actively. I think that you can let your friends know, like, hey, and I said it sort of in my speech, like, even if you're like doing okay right now, I just want you to know that like whenever you're not, you can come to me about it. And when those friends do come to you about things, if you're not able to provide them with the support that they need, direct them somewhere else. Don't just shut it down. Don't just be like, well, girl, good luck figuring it out. Be really active and intentional about if you can't support them, sending them in a direction that they will find the support that they need.
Yeah, absolutely. Thanks, Brandon. And lastly, Amatosh, would you close us out?
I would be honored, Jessica. I think kind of the number one mistake people do, so kind of to answer the anti-question, I suppose, would be, I think it's just human nature to be anecdotal when you're trying to relate to someone. So like, like let me pose an example to everyone. Let's say I'm like, talking to one of my friends about racism and like my name being really mispronounced. And they're like, oh yeah, one time a Starbucks barista misspelled my name in a cup. No. Just, you know what I mean? Like they're trying really hard to relate to me and to be anecdotal to make an organic connection. However, if you can't relate, don't force it. You don't need to be anecdotal. You don't need to relate to the struggle in order to be empathetic with someone. So when someone does confide into you, we've got two ears and one mouth for a reason. Listen to actively listen and hear them. And then when it is your turn, when they are looking, like Hannah said, for either just a vent or advice, then speak. If you are going to take on the role to give space, you need to make sure you're doing so appropriately and that people can be their authentic selves without having to hear your struggles and your tribulations, because ultimately that's not why they came. So that's just my 2 cents to kind of close us out with that.
Thank you all so much for your answers to this question. I think that all three of you have brought up such great points for tonight. And so to wrap up tonight's mental health forum, I just want to thank all three of our speakers tonight for your time, energy, and dedication to this event tonight. I know you all have put in a lot of work and have opened up the space for vulnerability. And so thank you, all three of you, so much for your work tonight. Thank you to our performances, Soto Soul a cappella and the Miami University Dance Theater, particularly Afua Do, who was the soloist tonight in that dance from the Miami University Dance Theater. So I want to thank those two student groups. I also want to thank members of the Miami University Associated Student Government for their endless support as Jessica and I worked to plan and put on this event. And lastly, to Dr. John Ward, and Dr. Stephen Large for their guidance and support as Jessica and I worked hard to put this program on tonight. Thank you all so much for coming out tonight to tonight's event. I hope you all have a wonderful, wonderful evening. Thank you all.